Good afternoon, everyone, and thank you for joining us for Day 4 of the AHI 2020 Leadership Summit, Uniting the Future of Population Health and Virtual Care. This is our 12th annual summit and our first ever virtual event. My name is Courtney Shaler. I manage the Adirondack Rural Health Network for AHI. I'm proud to welcome you today on behalf of our CEO, Eric Burton, our AHI Board of Directors, and our staff here at AHI. This afternoon's presentation, Meeting the Connectivity Challenge in Today's Digital Healthcare Environment, is presented by Jill Van Hosen of West-Telcom. I want to say a few words of thank you to the past sponsors we've had who over the 12 years have helped us lift this event up. We hope that we're in person in Lake Placid again soon and you can visit their vendor booths. Okay, I'm just going to go over a few best practice tips that will let you enjoy the summit, get the most enjoyment out of the summit today. Please confirm that you're muted and that your video is off upon entry. To avoid audio issues, please choose either computer audio or phone audio. Using both may result in an echo in the line. For optimal viewing, we recommend using side-by-side mode. To activate side-by-side mode, click on View Options at the top of your screen and choose side-by-side mode from the drop-down. Also, we suggest you use speaker view, that way you can see the video of the presenter and the slides at the same time. We encourage you to use the chat freely to submit all questions, technical issues, and comments. AHI staff will be monitoring the chat, and we will make sure questions are answered. Our presenter will speak for about 45 minutes. At that point, I'll come on and I will give the question to the presenter, and we'll have a nice dialogue back and forth. If in any case we don't get to all the questions, we'll make sure to connect you with our presenter after. And last but not least, all presentations will be archived on the AHI website by October 9th. This includes the recording from today and the slides as well. I'm now going to invite Jill to share her screen.
Can everybody see my screen?
I can see your screen, Jill, yes.
Beautiful. Good afternoon, everyone, and I want to thank you for coming to meet with us today and talk about the connectivity challenges that are happening in the digital healthcare environment, especially in rural northern New York. I am Jill Van Hosen. I'm the Director of Business Development with West-Telcom. West-Telcom has recently acquired TIO. They are another arm of us, just like Shazy Westport is our parent company, which I'm sure many of you are familiar with, out of Westport, New York. I'm going to go ahead and get started here. I just want to let everybody know that this presentation is all about computer connectivity that's presently available here in the North Country, not necessarily in all areas, but in areas to come, and how West-Telcom, along with TIO and Shazy Westport, is looking to bring what I like to say big city options to us small city rural communities up here. We are constantly striving to continue to upgrade our network and bring in some of the latest technology so that we can help you help yourselves and have great patient care. And it's tough up here. We all know that. There's not a lot of connectivity everywhere, but it's getting better. And I think as broadband grants come through and technology as far as cell phones and some of the things that we talk about today, I think that we're getting there. And I think that eventually we'll have some much better connectivity than we do today. And that's what this is all about. A lot of people understand connectivity and they think they understand computers, and everyone spent a lot of time on Zoom and at home and learning from home and telemedicine. So I'm hoping to take this presentation and show people what is there that there's out there, and basically get you to understand a little bit of the underlying technology that goes on that we have today, and what's also going to become available as we move forward into 2021 and beyond. Basically, in the present pandemic, I think that you can all agree that we've seen an explosion of telehealth and cloud computing. And basically, when it comes to telehealth and cloud computing, it's all about bandwidth. And bandwidth is basically what we provide at West-Telcom. We're the people that provide your transport network. We're the people that are providing your bandwidth. So as your technology needs emerge and become greater, we know that we need to be able to ramp up that bandwidth for you. And it can't be something that you put a call in for. It's something that needs to be always moving and not stagnant. So that's something that we're striving for, to make sure that our network stays available for you to have, because that's the most important thing, is what you can provide to your patient. Virtual care visits, here's a little bit of a few basically stats and statistics that we found, is growing by 683% in non-urgent virtual care visits, and 4.3% between March and April. And they are predicting that this is just going to continue to grow. And as we all know, as this grows, your network needs to grow. Your internal network, as well as our network, needs to continue to grow, because we need to be able to support your internal network. And technology basically affects all healthcare professionals now, and how not only how you care for your patients, but also how you collaborate with your colleagues. And I think that a lot of folks are getting more and more comfortable with using technology, but it's learning how to really harness it, learning what is going on in the background, and learning how to best work with your service providers so that you can begin to use voice, data, unified communications, cloud solutions, and even some of this new stuff that I'm going to talk about today, like software-defined networks and SD-WAN. These are the solutions that are the best practice solutions that are being used in much larger cities and not as rural areas of ours already. But this is what we know that we need to start moving to, and being able to provide to the small rural communities and the small rural hospitals, because this will be able to give you strong service levels and be able to support industry level care. And we want to make sure that rural Northern New York is able to do that, as well as metropolitan New York City. We also are very certain to keep the network and folks to make sure that your network is secure and also meets the regulatory requirements. We know there's regulatory requirements out there when it comes to HIPAA. There's also PCI, and there's a lot of different other requirements. And we want to make sure that we're providing a network that is already providing those requirements, so that one less headache that you have to worry about. This is just a quick slide to let you know, and for the folks that might not know, West Telecom has been involved with regional telemedicine projects since probably a good 10 years now, since at least 2009. And our network is basically built on the DANK backbone. We peer with many folks from SLIC to First Light. And West Telecom presently now is the one who provides internet network operations centers and threat intelligence services to both the NCTP and the Action Network. So we have been working hard over the last 10 to 15 years to build a fiber backbone and to build a connectivity network that can help you provide great patient care. And that's still one of our major priorities. And basically the deal that's becoming now, especially in light of the pandemic and the rise of telemedicine, is the growing reliance on accessing data in real time, because it no longer do you have that paper and, you know, okay, we're going to send this out to a lab and we're going to do that. I mean, a lot of it really comes down to being able to have right there all the time an ERM server program or cloud service program where you can access right there at your fingertips the patient's records and things like that, because that's where we're going in this day and age, not just here in rural Adirondacks and rural Northern New York, but also everywhere in the world. And that's how we can bring ourselves closer to the rest of the world. And basically, to be able to do that, it really does come down to your IT infrastructure. And that's what I'm hoping to explain a little bit today, is the infrastructure that we bring to the table and kind of what's going on in the background and what we've been working on, so that you guys can kind of think about how this really interacts with what you do on a daily basis, and how basically what this slide says. Advanced cloud services are what are going to be able to give you that scalable connectivity and meet the healthcare demands of the industry, and is going to be able to provide you and be able to let you give excellent patient care. Because this what this really comes down to is West Telecom and our other providers that we pair with to provide you a scalable infrastructure that is always on, mission critical, so that you can really not worry about that end of your business, but worry about patient care. And to that end, as I said on that slide previously, we have been working tirelessly to create our ringed network. As you can see here, our network basically spans about 600 miles from Lake Ontario to Lake Champlain. We run along the Dank backbone, but the real thing, and a lot of you have probably heard this, West Telecom's been around for a long time, but recently we have opened up our network and began to peer in what is called internet exchanges. So when we're peering in an internet exchange, that means that we have direct connectivity to all the cloud platforms. And presently we are in 2 internet exchanges, one called KIX in Montreal and one called NYNEX in New York City. The one in KIX in Montreal has 77 members. Some of the big ones that you might know: Amazon, Google, Limelight, Microsoft, Zayo, West Telecom. And our Vice President of Operations, Seth Crimmins, he's actually on the board of KIX, which gives us insight into how some of these big players are moving. And it also gives us insight into how other folks are using this large cloud infrastructure that just keeps growing and growing and growing on a daily basis. We are also in a larger internet exchange in New York City, which has 230 members in it. Here you can see that's where we peer directly with Google, Facebook, Microsoft, Netflix, Flickr, Twitter, Yahoo, Apple. And again, that means that our network, which I had shown on a couple screens ahead, is actually peering directly with these people. So when you have your information out there in an ERM system, or you're using Microsoft Office 365, or you're using Google Apps, you're just one hop from there. So you're getting better connectivity. You're being more productive because you're able to get the information down from the cloud and onto your local desktop quicker than if you were using another provider. In cloud, everybody hears a lot about it, and cloud solutions is really where things are moving towards. Very rarely now do you have people come in your office and say, okay, we're going to put in a server and we're going to put this local on your desktop or local on the server. No, everything's about the cloud. And I know that a lot of folks on this call are really medical professionals, and that's what you do on a daily basis is deal with patient care. But I think what I tried to do with this presentation is kind of let you step back for a minute and kind of understand what's going on these other realms in a very untechnical manner, so that you can kind of understand what these people are talking about when they come in and try to sell you a new system or a new platform. You can understand what exactly it is that they're trying to sell you. And basically, there's 3 things that a lot of people talk about nowadays: software as a service, platform as a service, and infrastructure as a service. So software as a service is especially interesting for private users like yourselves, as well as in a medical environment. This is when you talk about cloud-based applications and software. So that's things like Office 365, Dropbox, Google Drive, OneDrive, things along that nature. That's software as a service. Platform as a service is more where people either rent or buy certain portions of platforms where they can do their own development in, where you might actually rent a cube, they call it, in Amazon, or you might rent a stack in Azure. That is where you actually rent something and you put your program up there, and that's where you go out and access it. Again, that's why it's so important for someone like a West Telecom to be in these internet exchanges, because we can give you that one-hop connectivity. It's almost direct connectivity to your platforms if you choose to put things up in the cloud. And then infrastructure as a service is basically web services. When you're doing a little bit of storage and computing capacity, that's when you actually put something up there and you're actually going in and out and using it like an ERM system and things like that. So those are pretty much the three different types of services that are offered now. And a lot of people don't really understand the difference of them. So I wouldn't be surprised if I got a few questions on that. But this was just to give everybody an idea of what are the cloud solutions that are out there these days. We personally, as West Telecom, are a silver small mid-market and cloud service solution provider. With our direct connectivity to the cloud, we're allowed to have a cloud service provider designation with them. Not everyone is allowed to have that designation. Everyone can be a partner to Microsoft if they pay their dues, but you have to have competencies. The reason that we've chosen to go on with Microsoft is because they are doing a lot of stuff in the realm with Teams and when it comes to healthcare. And I wanted to make sure that everyone today, I don't really know what platforms you're using now. Zoom has really kind of taken on a big name in the market. I think it's because it had name recognition before the pandemic started and everyone kind of flocked to it. And Teams has been kind of like the redheaded stepchild in the background, but they are doing a ton of work in the background to make Teams a better platform and integrate it tightly with Office 365. So I think that they're trying to make a big headway in the market. And basically they've been working with a lot of healthcare providers out there, and they're going to be doing a new connector that will allow healthcare organizations basically to launch virtual consultations with your patients or colleagues while using Teams. So basically what that is that if you have the Office suite and Teams is part of it, you can use that right from your electronic health record system. As you can see here, they're working with Epic now. I'm not that familiar with that many healthcare vendors out there specific, but they are going to be the first ones to integrate with Teams. So what that's going to mean is that you're in your ERM system, your EHR system, excuse me, and you're going to be able to invoke Teams right from there, place a call, place a video call, and you'll have your system right there. You'll have your health records up, and then you'll be able to share that screen, do a whiteboard, all sorts of collaboration tools right from your program with your colleagues and or with your patients. And Teams is also going to integrate with the DAX experience, and they'll be using some AI. A lot of people hear about a lot of AI, which is artificial intelligence, and that's going to allow healthcare professionals to securely record interactions between their patients during healthcare consultations. And it's going to automatically generate clinical notes. So again, I've never been in healthcare, but I would hope that there's some people that are sitting in this audience saying, wow, it's going to really, by using AI, take my voice and literally transcribe it, and I won't have to do that anymore. And it's going to be like automatic. This is like some really big things coming on the horizon that Microsoft is doing. And they're doing it in the healthcare arena because, as they know, telemedicine, telehealth is just exploding because of the pandemic. But I think it's also something that's happened where, people don't want to use telemedicine, didn't want to allow telemedicine, then we had to allow it. But now that we've allowed it, like anything in technology, we're not going to go backwards. So these were just a couple of items that I thought would be interesting to this particular audience as far as what Microsoft's doing to integrate with healthcare. Voice is not going away, though. That's something else that I wanted to make sure that everybody understood. Everybody kind of gets all wrapped around now having a video conference with somebody, and let's have a meeting, but people are still going to pick up the phone. Your patients are still going to call you. So you still need a phone number and you still need great voice. And that's something that I just wanted to make sure that everyone understands, that traditional voice, which was something that has been around forever, analog phone, is really not that much different than what is now called VoIP or SIP, where things are done in the cloud and you don't have that physical copper line coming into your building, but instead you have an internet connection coming into your building, which goes into a router, which is basically a piece of equipment to lay people. But from there, it knows that is this a voice call? Is this some data that's going on your network? It does all of that work for you, as well as providing quality of service, full redundancy, higher reliability. And depending on your provider, especially in the case of West Telecom, we're able to provide network intelligence and reporting. So what's happening in the background there is that we're monitoring your network. We're making sure the bad guys aren't coming in. We're making sure that you're not getting taken down by a DDoS attack. And a DDoS attack is basically a bad actor out there just flooding your IP with just calls to it, which is basically just flooding it with data, hoping to make it come down. And so as we begin to get to a point in rural northern New York here where we have coverage and that folks can use data and voice in one, basically in one environment over one fiber pipe or one internet pipe coming into them, we can still provide multiple features in the high quality and performance that you need. So that's basically where we come in. And that's where I would think it's important for folks to understand that there's always advances in healthcare, and maybe sometimes up here we might be a little bit late to the game, and it seems to happen other places first. IT is sometimes the same way. You know, we know what's really going on and what can be going on, and like anybody else, be it your own private practice or a hospital, it's all driven by money and how much money you can spend on a particular project or a particular portion of your network. And that's where we stand, where we also too have to worry about what should we be advancing so that we can advance our healthcare providers in our healthcare partners so that they can provide the best customer service, patient care and customer service that they can. This is a quick little diagram I wanted to kind of show you so that you understood. I had shown you earlier our map of our network there and how we go out to the cloud platforms. And that's kind of was an overview of all of New York State. If you look here, this is kind of where our core switches are and how they go out to the platforms there. And we also have servers all the way out into Washington and into Dallas, Texas, because West Telecom is not only in rural northern New York, because just like how a lot of you are connected to other colleagues and other medical practices across the state, across the country, we need to be connected across the country, across the state, out to the PSTN, that's the public switching network. Those are the kind of things that we need to, because if we're not connected everywhere, we can't provide that connectivity back to you. Here's a little bit about network intelligence and about the Mission Critical app. And that's something that we pride ourselves on. And it's something that I think it's important for healthcare to know about and to think about when it comes to who your provider is and where you're getting your internet connectivity, because you really want someone in the background that, one, has designed their network to be mission critical, which is redundant, highly performing, high reliability, but also has the back end network and fabric where we can monitor everything for you. And that's what we do in the background. We monitor everything. That's what's going on here on the right side of the screen. This is us taking all of the mission critical information that comes from all of our customers, and it pushes it out into different reporting tools for us, so that basically we're able to find out that you're down before you even know you're down, because there might be something down a couple hops up the network from you that we're already working on to fix before it even gets to the point of affecting your practice. So it's very important to have someone that's working behind the scenes to ensure that everything stays up. Again, this is just a little bit about mission critical. And if you are a present West Hillcom customer and you don't already have our mission critical app, please be sure to contact me after this, because it's really a great way to put in support tickets. You can also set up your own monitoring where you can see if you're utilizing too much of your network, bandwidth and things like that. Say you're constantly getting complaints, or you're getting dropped when you're doing a video call and things like that. It's just something else that's right there on your cell phone. It's not something that you necessarily have to go somewhere else for. It can come to you as a push notification and things like that. A lot of people have push notifications now. And it just kind of gives you an idea of what's going on, gives you a little bit of ownership over your network so that you can be able to better provide patient care, and also find out if there's certain times where you're using your network to higher utilization than others. And that's when you can kind of look around and see, maybe we don't necessarily need to be sending those large files at the same time that someone is doing telemedicine. Maybe it's an idea of changing up the way you do your business and maybe the way you schedule things through the day and stuff like that. Again, we're here to help, and we're creating these tools so that we can help you provide great patient care. SD-WAN is a relatively new protocol and backbone that is happening across networks now. It's basically called software-defined wide area networks. And a wide area network, for folks that don't know what it is, a wide area network is basically a hospital and all of their outlying clinics, okay? That's basically a wide area network, because you have everyone on one quote unquote network, but they're in different locations. So when you have things in the same network but in different locations, normally you have either one huge pipe coming into the hospital, and from there we route things out to your smaller clinics, or you have separate connections at all of your clinics. A lot of times you'll have that one big pipe coming from the hospital to the clinic, and then some sort of backup connection at the smaller clinic, just in case for some reason that large pipe to the hospital got severed, but you still needed internet connectivity to do your work, get to the ERM system, things like that. And when you start beginning to look at SD-WAN as a new quote unquote product on the market, what SD-WAN does is it basically takes a technology and applies it to your connections between your outlying offices in your main office, and it basically uses them to the best of the ability. A lot of times now when folks have a main circuit and a backup circuit, a lot of times the backup circuit is not being used at all. So basically, a lot of times when the board sits down and it looks at expenses, because as everyone knows, in a practice, in any business that is, but definitely in healthcare too, that IT and those surrounding peripherals that go with IT is always an expense. We're always an expense, and you always have to be able to justify why you're having one more expense, why you're having new expense, and things like that. And SD-WAN is actually a great way to be able to no longer have that stagnant backup circuit, but have a backup circuit that is actually being load balanced and actually being used. So that's something that you can use to go to the board with and say, well, yes, it's going to cost X to bring in SD-WAN, but over the life of the contract, over the life, you'll see that we're now going to be using this circuit. So that means that this circuit is no longer just kind of quote unquote dead in the water, but it's also being utilized all the time. So you're not paying for something that used to only be used in a disaster recovery type situation. Business drivers for this really is redundancy and reliability. Because like I said, when you move into an SD-WAN environment, what that does is it gives you the ability to utilize those backup circuits. And now those backup circuits, before the backup circuits had to always be the same type of circuit as you had coming in. Well, with the advances in technology now, you can have a fiber circuit coming in from someone, and then you can have a separate provider that just brings you in a broadband connection. And that connection can be load balanced, like I was talking about previously, and you can be using both connections now to service some and all of your WAN at all times. So that's where the cost of redundancy goes down a little bit. And it also gives you network and appliance awareness, meaning you'll have insight into all of your appliances on your network, all of your circuits on your network, so that you can see where it really needs to go. And that's the next bullet, ability to steer the traffic where it needs to go, not always out a particular egress, because that's not the one that one could be getting saturated right now because we have 3 people on a telemedicine call. Centralized management and control and security. And I know that in a healthcare environment, and security is very, very important. And SD-WAN does that for you too, because it secures, it's another layer of security, another firewall-based appliance that once again secures your network, is able to provide, in the case of West Telecom, network intelligence back to us so we can see if there's any bad actors hitting any sort of, I guess, connection that you have. And we can prioritize mission critical applications over less urgent tasks. And then allows your IT staff to manage the multiple campuses from one location. You don't have to have a team in every anymore. And it will give you effective, reliable, and secure access to cloud platforms. And it also gives you visibility into all of your WAN, which means mobile devices, if they're on your network, different Internet of Things, and also remotely access things like your ERM that's up in a cloud environment. I did bring into this presentation a couple of use cases because I thought it might be able to give you a little idea of how this really works. Basically, in an SD-WAN, there's various connection types that can be used that can build this redundant, reliable network. And in this particular situation, there's a fiber, that's your Ethernet, broadband, internet, and then a cellular. That's really the latest in SD-WAN technology, is the ability to use cellular. And I think that cellular is going to be a big changer up here in rural healthcare, because cellular is getting better up here. And it's not as expensive to build as it is to build those miles of fiber or even build those miles of broadband. So if we can get into a rural clinic and put in an appliance that does need a broadband connection, but also is able to use cellular and be able to load balance those two, that is really going to be able to provide you connectivity that's private, secure, as well as redundant. So I think that's a big game changer up here in Northern New York. In the second case, this is just basically using the cellular again that I was just talking about. This is basically using it for backup, straight and simple backup, so that you have a primary connection to the internet, and then you have a secondary connection to the internet, which again is over the cellular that I had been talking about. And last is redundancy and reliability for the remote worker. That is where if you have a physician who needs to be working at home, we are now able to provide an appliance that has the ability to have their connection at home, be it Spectrum, be it any kind of broadband, DSL, Verizon, whatever it is. And then that firewall actually comes equipped with that card that I was telling you about earlier with the cellular connectivity in it. So there, when that is in the physician's in his own home environment, we're able to then load balance that stuff so that if he needs to be doing telemedicine or she needs to be doing telemedicine, but the kids need to go to school and they need to be, you know, doing something like that, games, content, anything like that, we can load balance that, and that can make them even more productive during times of shutdown and things like that. So just trying to make everyone understand that this is pretty much the future. I mean, this here is an actual diagram of one of our clients. It's a large banking client up here. Oh, excuse me, hospital client up here. And this just shows you kind of the different connectivities that you can have. All of the blue lines is their primary. That's their primary wide area network. Green is all their secondary connections. The black is all their primary internet. And the SD-WAN in their backups is all the red. So what it does basically is it's being controlled by our SD-WAN routers here, and it just knows how to load balance everything across so that no one is really ever not getting great service at all times, because it can pull from everywhere on all of these different circuits. The latest thing that is really coming out of the pandemic, and again, West Telecom knew that we needed to step up and make sure that we were able to really provide what folks needed now that working from home in the new normal is really going to be hanging around for a while, is something called unified communications. And unified communications is the blending of IP communication tools like telephony, mobility, presence, messaging, and meeting solutions. And that's basically that can be accessed anywhere, anytime, on any given device. Because customers now do want an all-encompassing tool that can deliver to them at a moment's notice the same experience. That's where Office 365 is such a great experience for everyone, because your email is on your desktop, your email is on your phone, your email is on your tablet. No matter where you go, it's all there. It's always up to date. And that's the same thing that happens here with UC. If you have a phone on your desk, you can pick it up, you can take it home, and it's there for you. A lot of people don't even need to pick up a phone anymore because they can just use the mobile app. And that's basically a UC system comes with voice, presence, email integration. When we talk about email integration, what that is, that's voicemail to email. CRM integration, meaning that you can pull in your contacts from either your ERM tool or maybe it's Salesforce or something like that. Presence-based call routing means that you can go in and you can set your own schedule. If you want people to ring your desk from 8 to 10 and from 10 to 11 to ring your cell phone and then turn around and ring your desk again, you can change that anytime you want. There's video conferencing that can go on through there, instant messaging, video, mobility, integrated fax. That's another really interesting thing. I know there's a lot of healthcare out there that still is using analog phone lines and fax machines. And again, West Telecom is always trying to stay on the top of cutting edge and being someone that can come out and help you provide better patient care. What is better and more productive for your practice than to no longer have someone to have to get up and go to a fax machine and worry for it to come through, paper jam, all that old-fashioned kind of stuff, but to have an integrated fax where it shows up directly in your receptionist's inbox. And then she can send that same fax right back through that inbox. That's the sort of things that UC is all about, and that what we're hoping to help healthcare move forward with. And an ID profile, ideal end user profile for UC Voice and SD-WAN, which is basically one of our products, I guess is the best way to put it, really is like the sweet spot for most of the businesses, healthcare environments, practices here in Northern New York. 1 to 500 full-time employees, multiple locations. And I think as much as healthcare never really thought about it, I think it's becoming more and more a mobile workforce. And as we all know, with the budget cuts and then, just the whole pandemic as a whole, I think that internal IT resources will become, if they're not already limited, will be getting more limited as we move forward here. So I think we're trying to make sure that people understand that it's time to start looking for that partner. It's time to look for that trusted provider that can provide you an all-in-one solution so that you can stay productive, but at the same time be using some of the best technology at the best pricing available, because IT can be expensive, but in the same sense, it needs to be affordable. This is just some of the remote workforce options, meaning that there's phones, like we always have phones, and they can be at your desk or you can pick it up and take it home. There's also the client on your computer where you can be making and receiving phone calls right on your computer using your computer hardware, or you could have it right on your cell phone. And again, like I was talking about Office 365, everything is the same. You can load up a CSV file of all of your contacts, and that's going to show up everywhere. It's going to show up on your phone, in your calls there, in your contact log there. It's going to show up in your Mac, in your cell phone on your Mac or your PC. And it's also going to show up on your mobile phone. So it's basically all in one anywhere you go. So it's always like you're calling from your office too. So it really is, it allows you to keep your personal number on your cell phone, but be using your cell phone as a business phone also. When you call out under one of your clients, it's coming from your desk phone or coming from your practice. It's just a little screenshot here of what it looks like. This is just your activity logs. And that's the other thing. I don't know how much recording is really done necessarily in the healthcare environment. Right now, I don't know if you record your calls with your patients or things like that. That's another really great feature that comes in this, is the ability to record the call. Like I had talked about earlier, Teams is looking to integrate that through AI and actually have that transcribed for you. But at least here in this product that we're bringing to the North Country now, you can record from right here. So you're going to have that conversation so that you can go back and transcribe from that. So I felt that was probably a pretty interesting thing to bring out to this particular audience, and something that you might find useful moving forward. For those of you that are not aware, we did just acquire TO and in that UC platform in July, and they have quite a large presence out on the West Coast, and West Telecom has a great presence here in New York, and we're going to kind of meld the two and meet in the middle and where we call the Mississippi, I guess. And I thought this was appropriate to speak about the case study here, as far as this was a cloud deployment in Phoenix, Arizona. They had 2 locations, 42 users, and mobile physicians that were traveling to various locations. Their pain points, which is probably similar to some of what you guys have, they have limited IT resources, an outdated phone system with antiquated features, and they have multiple different vendors with their hardware and their software, that kind of stuff. Sorry about that. And so
Jill, actually, can I just jump in there for a second? I've gotten a number of questions in the chat. People are asking if you can sort of tie this back to specific use cases in the North Country. So maybe you could show that video that you talked about.
Sure.
And
Do you want to
if
move
you
on
could
to
also,
that?
yeah, if we could move on to that, and then if you could take a few questions, because this is a good overview, but the partners are really looking for kind of that North Country piece, and I know you have a good footprint there, so you can speak to that.
Share it.
Americans will continue
Yes,
to
yes.
drive growth and create opportunities.
There we go.
Georgia's coastal plains. A nationwide effort is underway to bring high-speed internet to small-town America. Rural broadband providers are taking the initiative to bring advanced digital infrastructure to the regions and the people they serve. Their goal? To enhance quality of life by creating smart rural communities, which utilize a robust fiber network to jumpstart economic growth and improve access to first-rate education, healthcare, and government services. The work is far from over. Together, rural Americans will continue to drive growth and create opportunities by partnering with local telecom providers to build thriving smart rural communities. And it all starts with the transformative power of rural broadband networks.
That's great, Jill, thank you. Jill, can you speak more to the work you're doing in the North Country, and specifically, how are you working with large service providers on last mile build outs?
Okay, presently up in your area, as far as up in the Adirondacks, we are presently building out in the Peru area. And we are also building out with Slick towards the Canton, Potsdam, that sort of area. We spend an awful lot of time. We're going to be going into the third round of broadband grants out in the Shazy Westport area too. What happens with when it comes to some of West Telecom is not actually in the underserved areas when it comes to the broadband stuff.
Okay.
So, that part is not something that we can get involved in. That's where the Slicks and things like that come in, and then we begin to peer with them. But when it comes to broadband grants and stuff like that, we will
Oh, Jill, you're good. I had them move you just to speaker
Okay.
view so I could, so people
Okay,
could see
perfect,
better while you're
perfect.
answering questions.
okay.
Can you speak about how you and your organization advocate with state and federal organization agencies to expand broadband access in the rural areas?
I personally sit on the 80K broadband committee with some folks actually from AHI. And our president, Paul Barton, spends an awful lot of time in Washington meeting with the officials down there and making sure that they understand what is needed up here and continuing to push, you know, serving the underserved. And that's where we come in. That's where we come in working with DANK. And I know sometimes it seems like it's not moving fast enough. It's moving at the speed of government. So, you know, they'll say there's a broadband grant, and then it's going to take 18 months before they even award it. And then we got to start to work on it. And so I think that sometimes people that aren't in the industry think that it's not really moving, and constantly are we moving to make sure that we are always building our network. I mean, we're not the only ones up here. I mean, there's Slick, there's Champlain Telephone, there's First Light. I mean, and we all have our own OSP crews, and our OSP crews are out there day and night building infrastructure at all times. And because we're never going to be done until everybody has internet.
Okay, excellent. Jill, as far as what you were just saying, do you have a final thought to the group? And it does mean a lot when you said, you know, we're never going to be done until everybody needs internet, because we know, you know, especially those of us that serve these rural counties, you know, really we need that for our partners. So can you kind of speak to, like, you know, final thoughts on your presentation and kind of where you feel that the future is going to be in the next maybe 6 months to a year?
I think the next 6 months to the year are going to be very similar to what they have been. I think that telemedicine is here to stay.
Okay.
And I think that I was hoping to open folks' eyes up to the fact that West Telecom, along with the other providers that we peer with, are always looking for the best ways to provide excellent service and provide to the rural communities. And I think that this SD-WAN is what's going to be able to help. It's going to be able to lower costs for folks, and it's going to be able to utilize not only fiber, which is more expensive to run, it can utilize the broadband, and it can utilize the cell structure that is out there. Cell is something that we have not been able to harness until very recently. And as we get better with that as an industry, we're going to be better able to serve our customers with it. And in turn, they'll be able to better serve their customers with it, because 5G is coming. You know, I ran the video there of smart rural communities. That's a portion of the same thing as smart rural cities. So basically there's people like us, West Telecoms, the First Lights, the Slicks of the world, that are going to keep banging our head against the wall and banging our drums, because we want people to know that smart rural communities is just as important as smart cities. So we have to make sure that they understand that we're probably a little bit more underserved than the cities ever will be. So keep helping us help them.
Great. Thank you so much, Jill, for your presentation today. We really appreciate you joining us. Those of you on the line, tomorrow morning is our last AHI Leadership Summit presentation at 10 a.m. It will be the expansion of telehealth during the transition to the new normal of healthcare, a collaborative effort to enhance care during the pandemic. And that's a joint presentation between our partners at HCR Home Care and Hudson Headwaters Health Network. Thank you so much, and have a good evening, everyone. Thank you, Jill.
Thank you.